Good afternoon and welcome to episode 16 of the 3 Levels of Mind. This one is about depression. It's really hard to be depressed when you're sitting out in the Australian bush like this on a lovely summer's day. I feel a bit enlivened and whatever, but anyhow, I'm going to talk about depression because it's a very important subject, and depression, along with anxiety, are the two biggest things that seem to worry the human population at the moment. They're getting out of control and nobody seems to know how to stop it. The reason I come out into the bush is that, another reason I like to come out into the bush is that it's in the natural environment. So what I'm talking about, we came out of the natural environment, so that's what I'm talking about. And I don't have a big library of books sitting behind me that makes me seem as though I'm well read, because you don't get the knowledge that I'm trying to give you today doesn't come out of books. It comes out of my own brain, and hopefully it resonates with what's in your brain, the knowledge that's in your brain. And rather than have a big library of books, I can summarise all that in a little book like this because it's so simple. It's such a simple thing to understand. That primal pain causes anxiety, it causes depression, causes a lot of things. And to get that out of this, to get better from depression and anxiety, we just need to get rid of the primal pain out the body. And it only takes, I had to pad that book out to explain all that. So I'm going to start off this talk by describing how experts, so-called experts, view depression at the moment. It may surprise you that experts do not agree about what depression is, how to define it, or what causes it. So that's, they don't know what it is, how to define it, or what causes it. In primal therapy terms, depression is the repression of painful feelings. If your parents don't love you, you get that hurts you and you feel as though I'm not going to love. It's a life or death situation. And it's really painful to experience that. That's what we experience during primal therapy, is the pain of not being loved by parents. So that's what the cause is. And so the cure then becomes, we'll just feel the pain and your depression goes. And that's what's happened to me. It's not that easy a task, but it can be done. So defining depression is just the repression of primal pain. Pretty simple. Just write a little book like this. Many experts agree that depression is not one thing. It is a large family of illnesses with different causes and mechanism. Now that's just simply not true when you view the human mind through the 3 levels of psychological brain. The intellect, the feelings, and then right down in where our depression and our anxiety live. It's not a large family of illnesses, it's one illness. At the point of causation, it's one illness. It's lack of love from parents, lack of love from the community, lack of love all around. That's what causes the pain. And to say that it has many mechanisms is it's not understanding evolution, because evolution, like over millions of years, it hasn't generated a lot of mechanisms for us to get ill and then for us to get better. There's only one that I know of. The main mechanism of getting ill, mentally and physically, is through not being loved by your parents. And the mechanism to get better from that is to feel the pain of that. So there's really only, in my case, I believe there's only one cause and one cure, and that's what I wrote. That's what I explain in this book. There's only one cause and there's only one cure. And I'll just repeat what the experts say again. Many experts agree that depression is not one thing. It is a large family of illnesses with different causes and mechanisms. And then they go on to say, this makes choosing the best treatment for each person challenging. Well, I suppose it is for them because they don't really understand what it is. But for a primal therapist, it isn't challenging, because when anybody comes to therapy, whatever the diagnosis is, it's always going for the underlying feeling. The diagnosis, like depression, mood disorder, that's what you sense and that's what you experience in that level of your brain, the cognitive level of your brain, and you feel like shit, and you don't feel like doing anything. Life is just a struggle through the feeling. That's your mood disorder. And then right down here is the imprinting of not getting love from your parents. So the treatment is just to lay the person down in a darkened room, and we have the pretty simple ways and means. It takes a bit to learn them, but in the end they're pretty simple to get the person to go down through their 3 layers. So it's not challenging to come up with a mechanism to heal people. We know that it's bad imprinting down at the level of the sensation, which is in the brainstem midbrain area. So it's a pretty easy thing to do. The only thing is, it's a really tough journey, because we have a thing called a defence system, and it squashes everything down so that we don't feel that pain. Otherwise, we'd become disorganised and open for predators to get us and that sort of thing. So we've got to have a mechanism to shut it down. And it's like putting a lid. It's like putting a lid on a box. Once you've got the lid on it, all you can see is the lid. You can't see what's inside of it. And that's kind of how the medical profession look at depression at the moment. They look at it and all they see is the lid. All they see is what's happening in here. They simply have no understanding of what's happening down here. And that's how we treat depression, is to have that understanding. But this what I wanted to say is that this is, once you lift the lid on the defence system, it, like, everything just comes up and it's overwhelming. The depression, like, usually based around sadness or even anger, everybody gets surprised at how much anger and how much sadness that you have to express, because you've had a really good defence system to keep it out of conscious awareness. And so that's why people think, oh, it's not so bad. When I went to do my therapy, I thought I'd only take a year or two, but it's really a difficult journey. And the more people that can take that journey, the more we'll set up institutions that understand that, and will improve our parenting, because we have to improve our parenting to not imprint it in the lower brain in the first place. That's where the whole problem lies. The imprinting that we receive in the first few months of life. Because remember, in the first few months of life, this is the only part of our brain that's active. The sensations. We don't really actually. Scientists tell us we don't actually develop feelings, and about 6 months later, and then the cognitive abilities about 18 months later. So they come at a later date. So we've got to work our way back through those 3 layers to get rid of depression. Now, so psychiatry has medications. What medications do is they just block the flow of information between the layers. So it may make you feel better to some extent, but it makes you feel better because you're not feeling the bad feelings. But there's also good feelings down here too. So it blocks them. I mean, I had that experience when I had depression. I took an SSRI, and then what little feeling I did have was basically squashed out. It kind of helped me for a little bit, but it certainly wasn't a long-term cure by any means. So, and the trouble is with that, if you don't get rid of the primal pain, it's there. It still wreaks havoc. Like you've got the SSRI or the medication to shut off the messages coming up, but the damage is still being done. All the bad imprinting is still working away at your body, and so you're going to get sick mentally and physically as well. You'll get physical sick, because absolutely absolutely your mental mind has a great effect on your physical body. If you can get your mind right, get your brain right, you'll be a lot healthier on the physical level. I speak through experience with that. So I've come up with a saying that's pretty simple: get the pain out of the brain. That's basically what it is.